Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about unwanted moisture, that's sweaty palms, feet, and body odor. Now, because we live on an island, sweating is a normal occurrence, especially with the heat and humidity here. But for some people, sweat is more than just a nuisance. It's a daily problem, even in air conditioning. You might be surprised to know that as many as 1% of the world's population suffer from excessive sweating, which is known as hyperhidrosis. For other people, they have bromhidrosis, which is a fancy word for body odor. While sweat usually has no smell, the BO occurs when the bacteria multiplies rapidly on the surface of your skin. Now, here to tell us more about this sticky and sometimes stinky situation is Express Care's Dr. Jitka Lom. Thanks so much, Doc, for coming in. So what causes hyperhidrosis or excessive sweating?
Okay. Well, generally it's actually an inborn genetic defect that people have where they have a dysregulation of their sweat glands. And we all have sweat glands under our arms, in our groin, on our palms, and our soles of our feet. And they should help us with regulating our temperature. But some people, because of their genetics, have a problem there where the sweat is excessive. Emotional upset, anxiety, stress can make us sweat more. So people with anxiety disorders will sweat much more, perspire, but it will tend to be on their palms and soles, not so much in their armpits.
Okay. Now, how do you know if you have just normal sweating? You know, you and I were both talking about, we were both sweating today earlier because it's just so hot and running around. But how do you know if it's just normal sweating or if it's something more excessive?
Right. Well, there are situations where perspiration is excessive and actually a sign of a health problem. So, for example, if you're having night sweats or soaking the sheets and so on at nighttime, then there may be a serious health problem, for example, tuberculosis or even certain forms of cancer. But you would know because it would be associated with weight loss or fatigue or other generalized symptoms. And of course, women with menopause will be having hot flashes along with their sweat. So those are sort of some of the signs.
Now, are there ways to control it other than staying in the air conditioning or below freezing temperatures?
Well, I think that that's probably the best way for certain people. If they do notice that they're perspiring due to their emotions, then of course anti-anxiety medicine may help them. But in general, it's a question of keeping cool for those who are sweating in their underarms, groin, and palms and soles.
So is excessive sweating something that someone should be alarmed about?
It can be disabling. We joke about it, but it can actually be disabling when somebody cannot throw a ball or catch things or, hold a glass without it slipping through their hands, or their feet slip in their zoris. These can be serious concerns for them. So if it's affecting their ability to live a normal life, then it's a good reason for concern.
And I think you mentioned it, but I was going to ask, why is sweat often found on the palms of your hands and your feet and your armpits? But I guess that's where your sweat glands are.
That's it. The skin of those areas is really different than skin elsewhere. For our hands, for our palms and soles, there's of course no hair there, but there are many so-called eccrine glands, and these produce sweat. Again, they're more related to the control of our nervous system, basically less so for the thermoregulation, meaning it's not really related to controlling your temperature, it's more related to your nervous system.
Now, body odor, I guess growing up you just always kind of think, oh, that person must not shower, but some people actually, it's a problem and it's something that they cannot control. It's not because they're not showering, it's just...
No. Sometimes people are very clean, they're doing the best they can, but there are certain factors that make bacteria overgrow, as you mentioned in your introduction. When you have too many bacteria in the sweat, they actually eat the sweat and they eat the dead cells in that area, and then they produce chemicals that have really a very foul odor. So to control it, of course, you wash to get the bacteria off. Shaving actually makes it worse because you're disrupting the skin barrier a little bit, and also the hairs tend to wick the moisture away from the skin. So shaving actually can make your body odor worse. But also people that tend to eat a lot of meat will have a stronger odor than people who are vegetarian. You can know the difference for that when you smell a cow and smell a pig or some other carnivorous animal. So those are other factors, sometimes dietary.
All right, well, we'll continue our discussion on this sticky and sometimes stinky situation right after the break. Healthy Living returns after this timeout. Stay with us.